Pain sucks, there's no doubt about it. Not only is the sensation very uncomfortable, to put it mildly, but it can also, when severe, worsen movement, sleep, healing, stress, anxiety, depression, and mood, and reduce the overall quality of one's life. If you're someone who can relate, rest assured you're by no means alone. It has been estimated that as much as 1 in 5 people worldwide suffered from some type of it. And this is even more true if you're someone above a normal body weight. One large-scale survey done in the US incorporating over 1 million people found that if you're in the overweight BMI category, your risk of pain increases by 20%, while it further increases to 68%, 136%, and 254% for the class 1, 2, and 3 obesity at BMI categories, respectively. But keep in mind that pain is a broad term. It encapsulates things like musculoskeletal pain, psychogenic pain, headaches and migraines, referred pain, and visceral pain. And rarely is the prevalence of pain in meaningfully overweight persons attributable to one type, instead representing a complex interplay between a few of these. Nonetheless, it can be said that the most impactful of all in meaningfully overweight individuals is musculoskeletal pain, given how much excess weight can negatively affect joint stress, mobility, muscular imbalances, and inflammation. El Talawi et al. In 2021 described musculoskeletal pain as acute or chronic pain that affects nerves as well as bone, muscles, ligaments, and tendons. As such, we'll refer to musculoskeletal pain in this video as both somatic and neuropathic pain. Luckily, there are numerous evidence-based interventions out there to help it. But today we wanted to focus on a secret weapon for pain relief that's often overlooked and underutilized, even though it's well established in the literature as a valuable asset. So let's get into it. But first, as always, please take note of our disclaimer. First off, before getting to our secret weapon for weight-related pain, we wanted to address another intervention that many people dealing with it will typically undertake: medication use. El Talawi and colleagues say that, ideally, people should first receive patient education, preventative strategies, and non-pharmacological methods like exercise. But the problem is that they're not always enough for people with moderate to severe chronic pain. As such, the need for medicine is often necessary. One of the biggest downsides of medications, which won't come as news to you, is of course the potential for adverse effects. In one study, with a sample of almost 5,000 people from 16 different countries, 63% were found to worry about them. Potential side effects include things like nausea, drowsiness, allergic reactions, and potentially more severe health problems. But another one that's particularly notable for people who are meaningfully overweight already is the potential for further weight gain. Over-the-counter medications for acute mild pain like acetaminophen, ibuprofen, naproxone, or topical analgesics don't typically cause increases in actual fat gain. They can cause fluid retention to make people think that they've gained true fat though, which can cause frustration and potentially worsen motivation. Several prescription-based meds commonly given to meaningfully overweight people with chronic pain can though. One large US study incorporating adults with low back pain found that doctors provided 1 in 10 overweight and obese individuals with such medications. Anticonvulsants such as gabapentin and pregabalin are one example. One systematic review and meta-analysis found that gabapentin was shown to be associated with a weight gain of 2.2 kilos over just 6 weeks, while several RCTs have linked pregabalin to weight gain. Another example, despite some pushback against their use for musculoskeletal pain, is tricyclic antidepressants, since they've been demonstrated to have an analgesic effect apart from their antidepressant effect. One study carried out on 40 depressed outpatients from a private psychiatric practice receiving low to moderate doses of them found an average weight gain of approximately 0.6 to 1.3 kilos per month. And remember that acute or chronic pain also causes weight gain. A 2012 study by Janik and Kozak conducted semi-structured interviews on 30 obese adults and found that the participants would consume calorically dense foods in reaction to pain, for pain relief, as a distraction from pain, and from having less ability to undertake activities that provided joy in the absence of eating. Also, the subjects expressed that they had less physical activity and even less belief that they could engage in physical activity due to the pain. Therefore, with all this in mind, combined with the fact that pain becomes more prevalent the more someone increases in body weight, as we discussed at the onset, you can see how it can lead to a self-perpetuating cycle with weight gain for many. Accordingly, even though medication does have its place for treating chronic musculoskeletal pain in certain meaningfully overweight persons, this highlights the importance of doing as much as one can with non-pharmaceutical strategies. As laid out already, patient education is one of these. It involves influencing patients' behavior and knowledge through counseling, teaching, and behavior modification. However, pain education is a more specific, targeted approach when it comes to pain. It also goes by another name, pain neuroscience education, and is supported by current evidence in helping chronic musculoskeletal disorders. Unfortunately, though, it's been suggested that neither pain education nor overall patient education is used as much as it should be at the moment. One study found that only about 1 in 5 patients with lower back pain are given advice and education in a primary care setting. Even among practitioners who do use it for its benefits, many may still misinterpret it as simpler than it is, thinking that informing a patient more about their diagnosis and how best to tolerate pain is all there is to pain education. While these things, of course, are a step in the right direction, the most effective way goes much deeper than that. It includes explaining to the patient in depth the neurobiological and neurophysiological processes involved in their pain experience so that they can correct negative beliefs or perceptions that might be present concerning the pain. One typical example of false beliefs concerning pain is that it always equals harm, when, in actuality, chronic pain could present in an area even without any tissue damage, occurring rather from heightened sensitivity. Another is that rest is best since people think it helps the body recover from acute injuries. Indeed, it can, but too much can also be bad, as it can lead to deficits in mobility, strength, and stability. Accordingly, helping to clarify things like these and provide a deeper understanding of what's going on has been indicated to result in cognitive changes and positively influence pain severity, disability, fear of movement, anxiety, and catastrophization. As such, if you're someone dealing with chronic weight-related pain and would like assistance with pain neuroscience education, we can assist you with our evidence-based and results-backed personalized Plato weight management program. Please click the link in the top right-hand corner of the video or follow the link in the description. Additionally, if you're new here, make sure to like and subscribe to our channel. So, that has been our video. Thanks for watching, and I'll see you next time.